So welcome to the first in a series of interviews with Wisconsin experts in the field of children's mental health. I'm Linda Hall, Director of the Office of Children's Mental Health. Our office focuses on supporting Wisconsin's children in achieving their optimal social and emotional well-being. In this time of examining the competency and fairness of systems, we want to know what our collective impact partners are thinking about the children's mental health system and its effectiveness at addressing children's mental health conditions. Today, we're talking with collective impact partner, Dr. Brandon Currie. Brandon is an educator, guidance counselor, community leader, and chief executive officer of Strive 365. I'm delighted to have you with us today, Brandon.
Thank you, Linda. I appreciate the invite and excited to talk to you today.
Great. So let's start by having you tell us a little bit about your organization and how you support children's mental health.
Yeah, so Strive 365, we were created really to offer an additional layer of support, primarily around the city of Milwaukee in regards to social and emotional well-being for kids. And how we do that is we usually adapt to programs that are already created, and we add another layer of support through activities that we create while also modifying our curriculum to fit the needs of each individual partner.
Great. So with July being Minority Mental Health Awareness Month, we'd like to know your perspective on the intersection of race, trauma, and mental health. And why is this an important topic for us to focus on now and throughout the year?
I think it's extremely important, not only because of the climate we're currently in, but just because of the need to help groups that haven't always had a voice, that don't necessarily have a platform to create change. And I always talk about actively listening, hearing what they're saying their issues are, but then also coming up with solutions. It's one thing to just have discussions and to talk. It's another to actually put things in place that actually create change and give people hope. And that's really what our organization, Strive 365, as well as a lot of our community partners, we're committed to actually creating change, offering hope, offering support. And you do that by offering safety, empathy, and being positive and building those relationships so that trust is obviously at the core of what you're trying to accomplish during that developmental phase. And I think you can't have this holistic approach to creating change if you don't have a connectedness on all phases and everybody having an understanding of what's happening in the community, and continuing to ignore issues of race and equality completely ignores that connectedness piece that we're trying to achieve.
And so do I understand that with Strive 365, you are really, you focus a lot of these efforts with students in the schools and organizations you're working with?
Yeah, kids, youth, primarily ages, K through 12 are our primary focus. However, we do also, where we offer direct services to those students and work with our community partners because they're already doing great things, and we're just offering another layer of support to what they're doing. And we also understand the value in kind of the train the trainer model, where we're providing tools and resources to facilitators and people committed to impacting the youth. And we're just giving them strategies and techniques that we have in our curriculum that add to what they're already doing. So that's really our focus. We believe in the future, and in order for us to create that change, you have to start with the youth, I believe.
Exciting stuff. So the Children's Mental Health Collective Impact Network that we help to facilitate works towards systems change. What can you do as, so we want to know what we can do as a larger mental health system to more intentionally support the mental well-being of children of color in Wisconsin.
I think number one, be comfortable with being uncomfortable. You know, have those challenging conversations, actively listen, where you're hearing what these marginalized groups are saying that they need, how they feel they need to be supported, and go beyond just having the conversation, right? So, what are the next steps? Be action oriented in the approach. And when you're being action oriented, make sure that they're a part of what you plan on putting in place because they know what's best. These communities, specific groups know what will work best for their population and their community. So I think, being inclusive, showing an approach where it's more participatory, where you're working together to come up with solutions, that'll be the key to being the most successful, I believe.
Great. Thank you for that advice. And thank you for your insights here today.
Oh, no problem. It's been a pleasure.